former head of health analysis at the Office for National Statistics. Jamie, a very good morning to you.
Good morning, Mike.
Thanks very much. Sorry for taking a bit of time to get to you. I'm a bit wound up about the way this is affecting so many people, as if, they don't matter in this world. People who are, so far untouched by the actual virus itself, but who are massively affected by the side effects of the so-called cure.
Well, that's probably a good place to start with the statistics, I suppose, Mike.
Yes.
So you cannot forget the economic fallout of all of this. And the latest data we kind of have on the labour market and jobs, etc., that kind of showed that if you look at November compared to a year earlier, there were 800,000 people fewer on payrolls. So that's a staggering amount of people. Now, remember as well, Mike, we've also got the furlough scheme that's in place at this particular point in time. So that's masking possibly the true economic impact of this, because there may be some people who are on furlough, and when we come back out the back end of this pandemic, there may not actually be a job for them.
Yeah.
And so that 800,000 might actually end up going up more towards a million plus, which, it's a staggering amount of people. And remember that for every person who loses a job, there's going to be the stress and the anxiety, the financial impact of all of that. And that then comes with all the the mental health aspects. And you've talked about the mental health impacts on people and young people as well. So yeah, we cannot forget that there are all those other people who are affected outside of the actual numbers that we've got in terms of deaths, etc.
Exactly right, because when you think about some of the stats that you've been putting out on your Twitter account the last 24 hours or so, in the 7 days to 16th of January, there were 71.3 people of all ages for every 100,000 age 65 plus admitted to London hospitals. You're saying London seems to have hit a turning point. Tell us about that.
Yeah, so London was having this rapid rise in the number of hospital admissions, and I think a lot of people have been talking about the new variant, and I think we spoke a couple of weeks ago, Mike, that we are in winter, and you normally would expect a respiratory virus to start spreading and becoming more virulent throughout the society. So London has hit a turning point. The admissions are coming down in London, and remember, there's a time lag between people catching an infection and then ending up in hospital. So we've hit that turning point. Cases are down in London now. Cases are down across all parts of the country as well, which is reassuring with regards to the latest measures that are in place. They're coming down, hospital admissions in the south, east, and in the east as well. There are some parts of the country where they're a lot lower, but they are still rising. So you would hope that they will start coming down as well in the coming weeks.
Right.
So I think we are hitting a turning point, but ultimately, you'd expect that with the restrictions that are in place at the moment.
Well, whenever we have these conversations, Jamie, there's always two schools of thought, isn't there? There's always one school which says, this is because of the lockdown. This is because the lockdown happened at the beginning of January, and therefore we're now seeing the full rollout of that. But on the other hand, we sometimes get told it takes more than 3 weeks for that effect to be felt. And others will say, well, actually, by the time the lockdown started to hit, the peak had already happened. But we were hearing even as early as early part of this week that the peak hadn't come yet.
Well, I think we've probably passed the peak. I've heard some scientists calling for more restrictions, and I think obviously...
Well, you can always find some of them.
Yeah, well, the public have probably reached the fatigue with regards to all the restrictions, and the numbers are quite clear. We are seeing a positive downward trend. Now, in Wales, I was looking at the numbers before the national restrictions are coming in December there. We started seeing it turn down before the actual further national restrictions are coming in as well. So that's a positive sign. And I don't think if you look at the trends, Mike, if you look at the data, there were all this worry about people mixing for Christmas and this big spike that might cause.
Yeah.
You're not really seeing anything in the actual numbers themselves where you've seen a big spike because of the Christmas effect. Now, granted, it was much lower with regards to the number of days that people could mix, but I haven't seen anything in the data that would suggest there was a big spike in that.
Yeah, exactly right. And what did you make of Matt Hancock's statement yesterday, in which he was talking a bit about, being led once again by the data? Because I would like to see the government being a little bit more versatile here when it comes to looking at what has to be done in order to rescue some of the mental health problems that we're having in this country, as we started the conversation with. It's all very well saying, oh, well, we have to have this in place and that in place, and there are 4 tests. People have reminded me it's a bit like Gordon Brown's test to join the Euro. You'll never actually reach them. The 4 tests of lifting the lockdown, it seems to me, are variable, really.
Yeah, there's a number of different measures. There's the hospital aspect, so we're seeing that coming down. But I think one thing to point out with hospitals at the moment is if you actually look at A&E attendances in December, they were around a third lower than what they were a year ago. And that's, hundreds of thousands of people not turning up to A&E. Now, granted, when you've got restrictions in place that what we've got at the moment, that means that, people aren't going to be having as many car accidents. People aren't going to be out perhaps having fights in nightclubs, etc. So it's going to be fewer people coming into kind of hospitals. But
I remember my days in Cardiff, Jamie, with great fondness.
Well, yeah, that's a staggering amount of people, though, Mike, when you think about it.
Yes.
And the ONS data that came out just half an hour ago has been showing that since March, the number of people dying at home has been above the 5-year average since the start of the pandemic. So are people too scared to go to hospitals and seek medical care? And that's leading to unnecessary deaths as well. That's got to be a concern.
Yeah, I don't think there's any doubt about that. I mean, we saw a Channel 4 report last week about how numbers of people in their millions are having operations cancelled. People are waiting more than a year for something that would normally be done within a month. There's absolutely a crisis in the NHS, and it's not just a COVID crisis.
No, and I think that's going to play out now over the next maybe 5 years, because there's a huge backlog. Remember, every month there'll be new cases that would normally have come back into the health system. So you've got the backlog of all of last year. You're going to have all the new cases coming in. There's going to be obviously the impact potentially on mortality this 2021 for people who have got undiagnosed health problems from 2020 as well. So I think the fallout's going to be there for a while, and hopefully we're going to start coming out of it. I think it's still important to kind of point out some of the critical things that are causing some of the deaths beyond just the virus spreading around the community. So I've been looking at the latest stats yesterday for how many people are catching the virus in hospital.
Yeah.
And looking at the NHS England data. Now, people are talking about the second wave, Mike, starting around September time. Now, if you look at September, we've had about 26,500 from September up to, say, the 10th of January, 26,500 people in England who've potentially caught the virus in hospital, looking at when they actually tested positive.
And that's about one in 6 people, isn't it?
Yeah, it's around 1 in 6 people, 17%. And then in Wales, there's another 3,500 people on top of that. So that's 30,000 people. Now, remember, these are more vulnerable people, which obviously will lead to deaths. And I know in Wales that people have been talking about our hospital outbreaks and leading to excess deaths there. And then care homes, just looking at the latest stats this morning on that. So just under 1 in 5 deaths have occurred in care homes again in the latest week. Now, if we go from September there, that's 5,500 people in care homes who've died. We are seeing more people dying in care homes than what you'd expect for the time of year. And given that, sadly, many people in care homes died earlier on in the pandemic, so you might expect maybe deaths to be lower because obviously people can't sadly die twice.
Right.
I think that ring of steel that we've had around care homes since March is obviously kind of been failing us.
Well, I think that's right. And I mean, we've also been hearing stories, have we not, of hospitals dispatching patients back into care homes from hospitals without necessarily having a COVID test. So we don't even know whether once that's being done, that could be a problem. And so there still seems to me to be the most important sort of death statistic, if you like, which we've had from Matt Hancock, is that 88% of those dying from COVID are over the age of 70.
Yeah, so it's about 9 in 10 overall over the age of 65, and about just under half are over 85. Now, every death's obviously a tragedy, and I was looking at the actual death rates themselves and comparing different parts of the country, and I know you wanted a little talk about the vaccines, and we'll talk about that in a second. Now, if you look at the death rates across different parts of England and Wales, and then you look at the number of deaths, say, in each local authority across the country, and then look at that in relation to the population. Wales has had 3 of the top 4 areas for death rates. So Wales has been kind of having the highest death rates in the country. And sadly, I live in the worst one of all. We're on the kind of Daft.
And also, Wales, if I'm not mistaken, has had probably the tightest lockdowns of all of the 4 home nations, hasn't it?
Well, we've kind of got the unenviable kind of stat, I suppose, or stats in Wales, in that since the start of the pandemic, we've had the lowest testing rate. So that's looking at how many tests are being carried out in relation to the size of the population. So we have the lowest kind of testing rate. We've had the highest death rate. We've got one of the slowest vaccine kind of starting rates. And we've also had some of the strictest restrictions since the start of the pandemic as well. So all of these different things aren't putting Wales in a very good light at the moment.
Well, they're really not. Mark Drakeford's not exactly helping that, since you mentioned vaccines. I mean, yesterday people were scarcely able to believe what he was saying in terms of the logic of his argument. He's basically coming out and saying that he doesn't want to give away the vaccines too early because they might end up running out before they can get the rest of them organised, and there'll be people left standing around with nothing to do, which seems an extraordinary thing to say, doesn't it?
Well, it is extraordinary and some elderly people that I've been speaking to, obviously, rightly we would say they'd prefer to have the kind of the shot in the arm and let the staff have a day off if they are run out of vaccines. But I think on that point, the chief medical officers issued guidance about the second dose of the vaccine and not issuing that, and let's get everybody the first dose. Now in England, I think over 400,000 second doses have been administered. In Wales, there's very few second doses have been administered. So that discussion around we're holding back the vaccine just seems rather perverse, because they haven't been holding them back to issue them for second doses because they haven't been doing the second doses. So if you look across the country, over 4 million across the UK now have had the vaccine. Northern Ireland are leading the way if you look at the percentage of the population that have got them. If you say children aren't going to get in, just look at the ages 20 plus and the percentage of getting them. It's about 9% of Northern Ireland at the moment. It's about 8.2% in England, and Scotland and Wales are kind of lagging behind on 6%. And the actual increase that we're seeing per day, they are going up, but you get a weekend effect where it does seem that the restrictions possibly in putting the vaccine out, GP surgeries being closed, etc., means that they're a bit lower. But even in England and other parts of the country, they need to increase, and they are putting more vaccination centres in, but we are under kind of where you'd expect to be for the time if you are going to meet this target of getting everybody vaccinated by mid-February.
Yeah, and I get asked this question a lot, Jamie. I don't know if there's a way of finding out, but how many people who are admitted to hospital are then released from hospital? Because I've never seen that figure.
So we do get statistics on that. If you look at back in the week to the 6th of January, there were almost 2,000 patients discharged in England with COVID as well. So, yeah, we sometimes forget that. We hear the stories of how many people are going in. We hear about the death statistics.
Yeah.
But, the vast majority of people, good news there, are coming out of hospital. Now, there may be some, obviously, health effects off the back of that. There's a lot of talk about long COVID. But thankfully, the majority of people are coming out.
Yes, but I think that's a statistic that we should be getting on a daily, if not weekly basis. If the government keeps telling us, like we heard from Public Health England, or the NHS rather, the other day, that there's an admission every 30 seconds, well, how often is there somebody discharged? Because if that's the case, 20,000 plus a week in NHS England, they must all be going somewhere, because there's obviously room for them.
Yeah, well, then the total number of people actually in hospital isn't much different to what you'd expect for the time of year.
Right.
I think the concern is that if COVID...
Careful, you might get called a COVID denier by Neil O'Brien MP if you say things like that.
Well, but that's what the facts are. I think the concern, though, Mike, is that if COVID cases go up, what you tend to find is the number of patients going in with COVID, they're in longer than a normal admission. So that's what kind of stacks up. You get this kind of backlog in the system where more and more patients are going in, say, with COVID, and they're not going to come out as fast as you would normally expect with regards to the data. So, but we are seeing patients come down. And now if cases are coming down like they are, and new admissions are starting to come down, if we can continue that trend, then obviously we'll be over the back end of it. And the vaccination, in theory, what that is aimed to do, in particular with the elderly and the vulnerable people, which obviously will make up the sad bulk of the deaths, once those vaccines are administered, you would hope then that the pressure on the NHS would start coming out. And it would be useful then to kind of have some plan for the public as to what comes beyond the vaccine, what's going to happen with restrictions coming down, because there's kind of a lot of silence from the different governments across the country on that.
Well, that's the difficulty, isn't it? Because it's almost as though they don't want to release the plan, or they don't have a plan. It can't be both things, right? So equally, there was talk over the weekend and yesterday of March the 8th as being a possible date. The other thing I'm hearing a lot about is the schools, of course, because many parents are up in arms about some of the things that are being said. There was a guy out this morning talking called Steve Chalk, who runs a bunch of schools up and down the country, talking about the mood music of the teaching staff, saying that basically they're still not sure it's safe to go back to school, and maybe they shouldn't be reopening the schools after half term, and maybe they should keep them closed until Easter. And there seems to be no appetite whatsoever for taking care or taking any account of young people's mental state.
No, well, I've got two young children myself, and it is a challenge for the schools. I think when you look at the data, I think it's quite clear now that when the schools are kind of open, it does increase the number of cases overall in community, because children are humans as well, and they may be kind of transmitting it they don't get many symptoms, so it's very unlikely that you'll find them getting ill. And similar with teachers, if they're relatively younger teachers, they'll be quite safe, and if you're a vulnerable teacher, then obviously you would want to be kind of avoiding the situation there. But I think maybe there's a call maybe to we've got all the healthcare workers getting the vaccine. If the concern for the teachers is for them catching the virus and then passing that,
give them the vaccine
on, give them the vaccine. And I think why aren't we doing that? There's plenty obviously to kind of vaccinate. That would make sense to alleviate the concern for the teachers. And I think with regards to society as well, that with regards to getting the virus and then transmitting it, if most of the vulnerable people are given the vaccine, then it would then make sense to reopen the schools, because obviously Professor Chris Whitty has stood up on the podium many times over the last kind of 10 months saying that all the evidence shows that it's better for children to be in school,
of course it is,
and out of school, but we seem to be kind of dismissing that at the moment. And I think you can't really, Mike, when you're talking and learning about what's actually gone on here. And I was reading some reports this morning about £1 million a day being spent on consultants for the test and trace system. Now, the test and trace system, frankly, has been a total disaster for us, I think, because if the test and trace system was working effectively, then we wouldn't have had further restrictions in the autumn months, because we would have felt comfortable that as soon as we identify a case, we track everybody down and get them to isolate. And so you wouldn't need to have these restrictions. So I think the policies themselves that have had to come in after these massive spends that have gone on kind of illustrate the fact that we just haven't handled this pandemic very well at all.
No, I think you can only conclude that. That's the one thing you can conclude. Jamie, thank you very much indeed as ever. Jamie Jenkins, former head of health analysis at the Office for National Statistics.